Hey, it's me, Badby. I'm back. Today I had my oncology appointment and my fifth Herceptin and second Zoladex. This was actually the first meeting with my new oncologist because my last oncologist left and went to head the oncology department at a different hospital. And I was supposed to meet my new oncologist in December, but then she was sick and I met this other registrar guy, medical registrar. Today I was really excited to meet her. My appointment was at 1:30 and usually they're always late, but she was pretty much right at 1:30, like 1:35. I was super surprised. I think she's about my age-ish. I don't know, I can't tell. Well, I mean, yeah, I think she's about my age. She's really nice. She listened to my worries, asked if I had questions, answered all my questions. So she was like, yeah, so I understand you started the hormone therapy. How are you finding it? And I said, yeah, fine. I had some anxiety discharge when I started the exemestane. And with the Zoladex, I was just really anxious because I hate needles and it's really massive and I hate pain. And she's like, yeah, that's understandable. And I was like, yeah, I'm not sure if it's even working because I got my period and I'm getting like acne on my chest. And she's like, look, it actually takes like a couple of months to work. And I was like, oh, okay, fair enough. But she said, give it a few more months and see how you go. And then if it still doesn't seem like it's working, then we'll do a hormone panel, like blood panel. And I said, okay. What I wanted to know was did I achieve PCR? Because after my sentinel lymph node biopsy, I achieved PCR because there was no cancer behind my nipple or in my lymph nodes, but there was never any cancer in my lymph nodes. And I'm not sure if I got as far as the nipple because it was kind of lower down. It was like bottom right of my right breast. She said, yes. So what they excised of the tumor, there were no cancer cells or they were all dead in the tumor bed. So it's effectively PCR, which means your chance of longevity and there's a higher chance of no recurrence with a pathological complete response to chemo. She's like, it's the best possible outcome, actually. And I said, oh, awesome. And so last time I talked about wanting to get an oophorectomy because I don't want to have to do 5 years of hormone therapy, like Zoladex injections every month. It just gives me too much anxiety. And then she said, oh, it's probably closer to 10 years because you're so young. And I said, well, I just can't handle that. And she said, okay, well, usually with someone as young as you, we don't really do the surgery until it's been about a year because the body has to adjust to the no estrogen. So, on the Zoladex, you're going from like 80% and gradually bringing it down rather than 100% to 0%. And I said, yeah, no, I understand. So you're definitely not wanting to have kids? And I was like, no, I definitely don't want to have kids. She's like, oh, but you might change your mind. And I'm like, I'm not going to change my mind. I just went through the most difficult year of my life and my body has been destroyed. I'm not gonna voluntarily destroy it by trying to have kids. And by the time I finish the 5 to 10 years of hormone therapy, I'll be like minimum 40 or 45. Like that's not viable. And estrogen is one of the things fueling my cancer. Yeah, not going to happen. So my other question was, so some of my triple positive friends, they're on Herceptin and Perjeta, and I was on Herceptin and Perjeta during my neoadjuvant chemotherapy in Japan. And she said studies show that there is a slight benefit to have Herceptin and Perjeta in neoadjuvant chemotherapy, but for adjuvant chemotherapy after surgery, there is no benefit to having Perjeta as well as Herceptin. And in Australia, you only get Perjeta if you pay for it, which, I paid for everything in Japan anyway, so it doesn't matter. It seems like there's no benefit to Perjeta and Herceptin as opposed to just Herceptin by itself. That answered one of my questions. And she answered the other question about the PCR. My third question was about the aromatase inhibitors. I'm not sure if I'm saying that right. Aromatase, I don't know. AIs. So there's obviously like Zoladex or Lupron, or there's exemestane, letrozole, and anastrozole. I asked why this combination, and she said, yeah, it's an interesting combination. And I said, why? Why is it interesting? And she said, with Zoladex and Lupron's just the liquid version, and there's the 3 monthly or the 1 monthly Zoladex, but 3 monthly isn't shown to have benefits for premenopausal women. So I said, okay, that's fine, I understand that. But then, why exemestane out of the letrozole, anastrozole, and exemestane pill AIs. And she said, well, I think it just depends on what you're used to prescribing. So she would always go with letrozole, but then there's no medical benefit and there's no medical difference between exemestane and letrozole. So usually she would go with letrozole, and if you didn't tolerate it well, she would then go with exemestane. And I said, oh my God, should I change? And she said, look, if you're on tamoxifen, which we know isn't as effective for premenopausal women or young women, then I would definitely change you. But there seems to be no side effects for you at the moment, and like you're tolerating it well. Medically, they're both the same, like they do the same thing. And I was like, okay, cool. So I feel really good about that. So she said to me she'll probably be able to speed up. So I have my appointment with the gynae next week. She'll keep in touch with them and they'll probably be able to speed up my oophorectomy, but I'll still have to have like at least 2 more Zoladex injections, which I'm absolutely dreading. My first one and my second one I've had with Herceptin at the chemo day unit at the hospital, but they can't do my Zoladex injections there unless they coincide with my Herceptin, and I would have to get it at my GP, but my GP is really far away because he's been my GP since my parents came to Australia. So we moved from there a very long time ago, but I don't really want to change GP because this person has literally seen me grow up. So I guess I'll just have to make the hike out there. My Herceptin and Zoladex infusion was meant to be at 2:15. I got there at about 2:10, 2:30. I was still waiting. I met this like nice woman, young woman in the waiting room though, and she has breast cancer also, but she's like ER positive, HER2 positive, and PR negative, which I've never heard of that combination. She's having her surgery like next week, and she was on TCHP. It's just weird, like the different types of treatment that you're on. Anyway, she gets a Zoladex and she's like, yeah, I don't put on Emla. Because I was like, I'm so worried my Emla's going to wear off because I put it on like 45 minutes ago. She's like, I don't use any of it. And I was like, oh my God. She's like super strong. I didn't get any of her details though. Hope I see her again. We weren't anywhere near each other. I had a new nurse today. She usually works on the chemo ward. She's so nice, like kind of an older lady, but yeah, she's so nice. So gentle, like I could just tell. She did everything really nice, and she's like, yeah, you're doing really great. Like just the whole time was super nice. She's like, how are you tolerating everything? I was like, yeah, fine. I've just got like heaps of anxiety because of Zoladex. I'm really afraid. She's like, no, I get it. It's a really big needle. She's like, just don't look. And like she did it and I didn't feel a thing. I kind of felt like a little pinch with the port needle. Everything was over in like 45 minutes, an hour maybe, but yeah, they were slammed again. It's like she was looking after 4 different people at the same time, and there were a couple of nurses just kind of walking around not doing anything. I don't know, it's a weird system. Overall, I feel like it went well. Just dreading the rest of the Zolodexes. And they're just, because they're on alternating weeks. My husband lives overseas. I just got back from visiting him. I'd like to go visit him again. But then I've got appointments the 18th of January, the 1st of February, 2nd of February, 22nd of February, 27th of February, 29th of February. I don't have time to be able to see him, or I do, but it's like it won't be worth the price of the airfare. It's just so frustrating. I hate long distance. I'll get into that another time. Anyway, here's my little port sticky dot, and here's the sticky dot for, I don't know if you can see it. Here it is for my Zoladex. I haven't taken it off yet. Maybe I should. Well, you can see a tiny little baby hole. It's fine. Oh, a little bit of blood. That's okay. All right, maybe I should do the same for my port. Oh, it always hurts. It's so sticky. Ugh, there's a bit more blood. Okay, not too bad. I'm gonna have a shower now. Yeah, I was really sleepy when I got back from Herceptin, and I actually needed a nap and had some cheesels. Because, yeah, I guess I needed the saltiness. I don't know. Anyway, stay tuned for more cancer things.